Hello, I'm Rico Cavella, and this is your Ageless Body Self-Care Guide, Operations Manual for your body and for your mind. And the title of this session is all about foot care. I think we tend to kind of forget about our feet and we kind of neglect our feet a lot. I guess maybe because they're so far away from our brain, right? I guess. So this is going to be a really important session. We're going to learn really all about how to take care of our feet. And we have the perfect expert and teacher today. Her name is Dr. Emily Spleichel, and she is a podiatrist. She's a human movement specialist and global leader in barefoot science and rehabilitation. And I really like what she has on her website. She says she approaches every patient with the belief that we hold the power to our health and well-being in our own hands. That is so good, and I so much agree with that. So, Dr. Emily, thanks so much for being here.
Absolutely. Thank you. It's a pleasure to be part of your series.
Yeah, thank you so much. So, well, let's just dive right in here. So, my first question for you is talk a little bit about the importance of having healthy feet and how it relates to our overall health and well being.
Yeah, so I look at the feet as a very powerful gateway into our nervous system. And it is the foundation to our posture, our body alignment, and then, of course, how we move. So, if we have weak feet or we are disconnected from our feet, meaning from a sensory perspective, then that starts to alter how we stand. We're not aware of our posture through the rest of our body, or maybe we start moving a little less efficient. This is where I start to see a lot of foot pain. So that could be arch pain, heel pain, plantar fasciitis, things like that. Is that people start to lose this connection to their foot strength and their really overall foot awareness. So my goal through being a functional podiatrist is to build that awareness to our feet, our foundation, our posture, our body alignment, and the way that we move.
So well said. Yeah, that's so important. I think people have to need to realize that. Yeah, the importance of your feet. It has to do with everything with our balance and our posture and our alignment and I know you say the science of barefoot science. Talk a little bit about what barefoot science is all about.
Yeah, so barefoot science is less about being literally barefoot, but more about connecting to our natural foot function. So this means that you are getting barefoot, you're getting out of your shoes every day. You are bringing important sensory stimulation through your feet. This could be just you walking around your home barefoot. That is allowing you to sensory activate the feet. And then it also allows you to strengthen the small muscles of your feet. So you could think of the small muscles of the feet kind of like your deep core. So if you've ever heard of people speaking about you need strong core to protect your lower back and to stand tall, and our core muscles are so strong and so important. Same thing with our feet is we have small muscles in our feet that need to be trained. They need to be strengthened. And the longer that we're in shoes, and we avoid this barefoot, our feet actually become weaker from a muscular perspective. So to me, barefoot science means sensory, get literally barefoot, but it also means to strengthen the small muscles of the feet. And that can be done through barefoot training and to do minimalist type movement.
Well, there's a thing called grounding, as you well, and well, not grounding. Now I forget the term. It's where
Earthing.
you, huh? Earthing. Yeah, that's what I'm thinking about. And I do that every day. I'm fortunate to live near the beach here in San Diego, and I either walk in the water, the sand, or at the park. So it's so important to get out and walk on. I think on the earth barefoot as well.
Well, yes. So that would be the third layer that I think is also really important is to be barefoot and to connect to the earth is very important. And for those that are not familiar with earthing, and you can actually call it grounding as well, is that the earth has a negative charge to it. So kind of like a magnet, earth has negative, we have positive. Now, positive charges in the body are acidic. So you could think of our body gets acidic or all of these free radicals and inflammation. All of those, I like the patient or the end user to just think synonymously. Now, by connecting to the earth and that negative polarity, you essentially cancel out the positive acidity, free radicals, inflammation in the body. So it is a longevity methodology that I use, that I recommend to people. So yeah, that would be the third layer to being barefoot science.
How long would you say you need to walk barefoot on the earth every day? About how long would be enough to be beneficial?
So just like 15 minutes, the research will show.
15 minutes. Really
Yep. And
good.
if you do it on, first thing in the morning, sometimes you get dew on the grass. So the early in the morning, that actually you get a easier or a more efficient grounding because the water acts as a conduit for the
Mm.
electrical charges.
Yeah, so good. Well, you mentioned too about foot strength and exercises too. We'll talk about that in just a minute. But so, what do you think about orthotics and because I know some people say, I mean, they may have some benefit, but they also tend to make your foot weak then, right?
Yeah, so I'm a podiatrist that does not quickly push patients into orthotics. There is a time and place and appropriateness for orthotics, but oftentimes in many cases, I'm actually getting my patients out of their orthotics
Yeah.
because yes, there is research that shows the longer that you are in orthotics, especially if you don't really need them. That's what I would say. If you don't actually need the orthotics and you go into a arch support, you become reliant on that arch support versus the small muscles in your foot. This is very similar to supportive shoes and cushioned shoes, is you become reliant on these devices. Now, let's say if you happen to need orthotics or you like to be in them, I tell my patients to not just rely on the orthotic and then never strengthen your feet again. We need to still do that combination of barefoot stimulation, foot strength, walk around barefoot, get the muscles engaged, even though you're in the orthotic. So I would say find that balance. If you feel like you're fine without the orthotics, then maybe you don't need orthotics. Or if you just want to strengthen the feet, then absolutely do that as well. So there's a time and place for them, but a majority of people actually don't need them.
Yeah, that's so good. Uh, so what do you think about I know there's kind of a movement of a lot of people who like to go out and run barefooted. And and also I know there's some new shoe makers that are making shoes that without all those arch supports and stuff. What do you think about that?
Yeah, so the barefoot running boom and the minimalist shoe boom of 2008, 9, 10, that was kind of the peak of that boom. What that really demonstrated is it brought a awareness or a disruption to what a lot of the footwear industry was telling the consumer, that we need support, we need cushion, and allowed the consumer or the patient to then think on their own that maybe I don't need this. So I am in favor, in a majority of cases, for minimal shoes. So more barefoot shoes. Some people will call them barefoot shoes.
Mhm.
And the reason is that the more structure and cushion and barrier between your foot and the ground, you make weaker feet, you disconnect from the ground from a neurological perspective. And then again, you become dependent on these devices. There are exceptions to everything. So certain people cannot tolerate minimal shoes.
Mhm.
Now, actual barefoot running is really not the barefoot running boom what it was about. All these barefoot runners were really in minimal shoes. There are people who do run barefoot. You just have to do it progressively. You have to do it intelligently. And you have to make sure that you're fitting in appropriate recovery as well. So if any of the listeners to this are wanting to transition out of traditional supportive shoes into a minimal shoe or a barefoot shoe, you want to do that slowly, and you want to do it while building foot strength at the same time.
Mhm.
And you want to do it while integrating foot recovery at the same time. The easiest foot recovery would be to release your feet while you're brushing your teeth, I tell people. So 5 minutes in the morning, 5 minutes in the evening, just stand or walk on a lacrosse ball or a golf ball, something, and just release the muscles in the bottom of the feet.
Yeah, so good. Thank you. I think before we go on with some of your, well, we haven't even talked about some of the really common foot problems they have. But I think we just mentioned a little bit about reflexology. You know how almost all the organs and all the nerves are in the bottom of our feet.
Yeah, I mean, so that's just another demonstration of how powerful our feet are. So I personally don't practice reflexology. So I'm not a reflexologist, but I go to a reflexologist and I refer my patients to reflexologists because I think that there is that much power within the foot. What is great about research behind reflexology is it shows that it down regulates your autonomic nervous system.
Mm.
So for those that might have heard of like fight or flight, rest, digest, that's your autonomic nervous system. And it can essentially take you out of a fight or flight state and calm you down into this relaxed state, which is great for anyone with anxiety, PTSD, type A personality, stressed out, whatever might be kind of going through their system. Reflexology is a powerful way to influence that aspect.
Wow, really good. Okay, we'll talk just a little bit about some of what are the common foot problems and ailments that you see commonly.
I would say probably some of the most common are going to be heel pain or plantar fasciitis. That's one of the big ones.
Mhm.
Bunions, which is a deviation of the first long bone in the foot called a metatarsal. And then you get this bump on the inside of your foot, kind of an angulation of the big toe. You can get arthritis in the big toe joint. That's another big one. Hammer toes, where the toes contract inwards. That puts a lot of pressure on the ball of the foot. Neuromas. A neuroma is a ball of scarred nerve tissue, which can create tingling and numbness into the toes. It also can be quite painful. I would say Achilles tendonitis, which is, of course, in your Achilles tendon. And then the last big one that has to do with neurological would be neuropathy. So some sort of decreased sensation of the feet.
So, what are some of the root causes of some of these ailments?
A lot of them has to do with weak feet. Now, the cause of the weak feet could be several things. It could be that you have ligament laxity. So that's kind of a genetic one that predisposes people to these conditions. This is where people say they have flat feet. So having flat feet, you could start to associate with weak feet, but flat feet doesn't necessarily, it's not a term I like to use. It's really overpronation. So overpronation, when your foot collapses in,
Mhm.
is what lay people would call flat feet. That is a weak foot. That is a slow foot. Now, is that foot type caused by ligament laxity, which I mentioned? That's genetic. Is it because you have weak muscles in your feet? That could be. Is it rigid? So it's actually structural. That is something as well. Or is it because you actually have weakness higher up in your body? Your glutes are weak, your core is weak,
Mm.
and then that affects your foot strength. So those are some of the most common causes of flat feet overpronation, which is the most common cause of almost everything I just mentioned.
Yeah, that's so good. Well, I really like how you take a really integrative approach, a real holistic approach to seeing what people's problems are. I just have a real quick testimony for podiatry because I remember, many years ago, I was getting this, it was like a wart on the, right, in the bottom of my ball of my foot. And so I go see a regular doctor and they go, oh, okay. And they burn it off. It's like a wart, and then it just come right back. And it hurt a little bit, And I did this about 3 times. And finally I realized something's wrong here. So I went to see a podiatrist and he goes, that's not a wart. That's that's your foot. That's your foot making a protection because one of my metatarsals had kind of fallen down, and he just went in there and real simple little thing and got that metatarsal blown back up, healed up, and was doing perfect. So if you have any foot problems, you definitely want to see a good podiatrist like Dr. Emily. Yeah, for sure.
Yeah, I hear stories like that, the feet are really complex and there's all this subtle pathology that I do encourage people as well, not just because I'm a podiatrist, but really to go to a specialist for different specialties within the body, because I think the foot deserves a specialist that a general practitioner, or even if you go to the urgent care, they don't understand some of the subtleties in the complexity of the foot.
Yeah, absolutely right. Okay, well, so now we talked about all those different things and all the benefit, all the important things about the food and some of the things that go wrong. So give us your what would be a daily recommendation of exercises and ways that you need to really take care of your feet in order to create good foot health.
Absolutely. So I recommend, had already mentioned it, but starting your day by releasing your feet. So you're barefoot, you're getting ready in the morning, brushing your teeth, putting on makeup, whatever it is that you're doing. You want to release your feet simultaneously. So I have two lacrosse balls or two golf balls in my bathroom, and I just leave them there. So I release my feet every single morning. I've been doing it for probably a good 15 years. And then you want to have at least 30 minutes of barefoot stimulation throughout your day. That could be just in the morning when you're getting ready. That could be you doing 15 minutes of grounding outside that we had mentioned. But if we can get at least that 30 minutes of sensory stimulation, then when you go to work or put your shoes on, you're doing your day, choose shoes that allow you to continue to strengthen your feet and get that sensory stimulation. Is it a more barefoot minimal shoe, one that you can roll and twist and turn? If you can tolerate that, that would be ideal. Then, if you can, at the end of the day, release your feet again. Now, that would be what's required every day. And then I recommend 2 to 3 additional days to do 30 minutes of focused, targeted foot strengthening exercises, exercises that are incorporated with your core strength. Easy example would be like Pilates, yoga, balance training. If you go to the gym, could you do your exercises barefoot so that you bring that strength into the body? So that's what I look at from a kind of a movement longevity, barefoot strong lifestyle, is through that sensory foot strength and foot recovery.
Yeah, that's so good. But let me ask you, okay, so if you're going to use a golf ball and you roll your foot, so how long do you need to do that?
So just 5 minutes, 5 minutes, and
5 minutes.
it doesn't matter the product. So there's so many foot products that are on the market for releasing your feet. You could just use um, I mean, it's a silly example, but like a rolling pin, right? So something that's on the floor, right? So there's analogous to that. Some people have little dumbbells. You can put the dumbbell on the floor,
Oh
and then
yeah.
you're just on the handle part of the dumbbell. Get creative on it. What I tell my patients is, as long as you do it, that's what makes me happy. And then if you want to get into specific products and specific technique, I have videos about that on my YouTube channel.
Oh, really good, really nice. Okay, now I have to ask you about high heel shoes. What
Mhm.
about high heels? They look so good, but I don't think they're so good for you, are they?
Yes, so same. They look good, but they're not they're not good for your feet.
Yeah.
They're actually not good for your body. So what they do to your feet is, obviously they are going to be constricting the front of the foot. So they pull you into more this pointed position, or this narrowing of the toes and the forefoot or the front of the foot. And then because you're in a heeled position, or a heel lift position, you are tightening the muscles in the bottom of the foot and the back of the leg, and you're keeping it in that static position for however long you have the heels on. Whereas normally in other shoes, you keep walking, moving, and you go through these different foot positions. In a high heel, you are stuck in one position, and it is a position of tightness. So chronic high heel use technically makes your calves tight, your Achilles tendon tight, your feet tight, etc. The other thing that it does is that, because you're elevated up, for anyone who's just standing and curious, they can do a calf raise, and you feel that it throws your body weight forward, but we obviously don't want to fall forward. So you counter that by
Mm,
bringing your upper body back, and then you get this huge arch in your lower back. That lordotic curvature of your lower
mm,
back compresses your spine and your vertebra, and then that can create low back pain. What that also does is that your head then pitches forward. So you start to get cervical changes, lumbar changes, and then of course, knee and foot changes. So it is really stressful to the body, it's really damaging to the body. So what I tell patients and consumers is, if you're going to wear them, which almost every woman at some point has or may wear them, then you want to do something to reset the body. How do we reverse the stress of that environment? Open up our hips, open up our rib cage, stretch our calves, release our feet, create a toe spacer in between all of the digits. Things to essentially just reverse that stress.
Yeah, that's so good. Yeah, thank you so much for that. What about soaking the feet? Anything in particular there that's really beneficial with?
Yes, so it depends on the condition. So probably one of the most common ones would be like an Epsom salt soak.
Hmm.
So Epsom salt soak is great. I am obsessed with Epsom salt, partly because the magnesium is so good for your body.
Yeah.
So Epsom salt has magnesium in it, and the magnesium is good for muscles, muscle recovery. It's an electrolyte, is how you could look at it. It's also really good for how you regulate sleep. So if people are finding that they have a hard time falling asleep, you can do Epsom salt soaks. You could do an Epsom salt bath. If you're starting to get the early signs of heel pain or ball of foot pain, foot fatigue, diffuse foot pain that you can't identify anywhere, you could just do an Epsom salt soak consistently every day for probably good 15 to 30 minutes if you can tolerate it, and do that every night for a good week. You probably will see a great difference. Another one that we use for people who sweat excessively, which is a condition we didn't speak about, but you can actually soak your feet in tea. So you can make tea, like black tea, brew it, cool it down, and then soak your feet in it. And you do that for 7 days straight. And it's something that actually shrinks your sweat glands so you don't sweat as much through your feet.
Oh, one thing I wanted to ask you about, I almost forgot, was what about ideas you have for toenail fungus?
Yes, that is a hard one because toenail fungus is very different than fungus in the skin.
Mm.
So, fungus in the skin can typically respond within 2 months. So, you just have to be consistent with your treatment for 2 months. The nail fungus is different because it's underneath the nail bed. So if you put something on top of the nail itself, you have to go through all of that keratin. And the keratin, think of it almost like bone or like a ram's horn, right? So horns are made of the same thing that our nails are made of. And to try to penetrate that is actually very difficult from a medicine perspective. So most antifungal treatments for nails that are the most effective, you have to take by mouth. So
Mhm.
that would be like the Lamisil or terbinafine that people might have seen commercials for. Um, it's otherwise very difficult to get rid of fungal nails.
Yeah, absolutely right. Well, I want to remind people that there's also a PDF that comes along with this video training. So you want to be sure and go there. As Dr. Emily said, she has lots of more information that you can learn a lot more from her on her website. And I know she has some free information there for you. And you can also contact her if you need to learn more information or get some help from her. So be sure and check out your PDF. So Dr. Emily, that's been so good, such great information. So just anything else that you think that you'd like to say to, and also here's the last question too that I always ask all the people that I'm interviewing is, I like to say that, knowledge without action is useless, right? So what do you have to say that maybe you could inspire people to actually take some action on your recommendations?
So I actually like the quote that you had mentioned in the beginning, and that's on my website. I actually have patients sign that when they see me as patients. They have to approve and say, yes, I will be an active part of my recovery or of my treatment plan. So what I would say is from any of the changes of any of the professionals that you're listening to, or just in general, is you want to be thinking of it from a lifestyle versus I'm doing this for a month and then I never do it again, kind of like diets where you're doing kind of this short-term quick results and then you stop doing it. Those don't work. Diets never work. Lifestyle changes work. So what can you do from a small change that is consistent that becomes your lifestyle? So small changes consistently make the biggest impact. Starting by just releasing your feet 5 minutes in the morning every single day as a lifestyle change is going to have a greater impact than you doing something short term 2 times a week for 2 months. So that would be my advice for literally everything, not just the foot, but just in general, your health.
So good. Thank you so much for that. And again, I want to remind you that I promise you that if you begin to follow these recommendations that we're offering here from these great experts that I promise you that you can trust, they're giving you the right information, it will greatly improve your overall health and well-being. And that's what this whole project is all about. So you just have to step up and take responsibility for your health, and you can do it. So thanks for being here. And Dr. Emily, that was so good. Thank you so much.
Of course. Thank you.